very quickly, a lot of folks are hauling out their ladders. They want to start decorating. That's why Dr. David Weiss from UVA Medical Center is here. We're here to talk a little bit about climbing up on that ladder. And you are an orthopedic surgeon, correct?
That's
Dealing with all the broken bones. So tell me a little bit about, first of all, let's talk about stats. Do you have a lot of folks this time of year who come to the ER with, oh, hey, accidentally fell off the ladder?
Yeah, unfortunately, this time of year, you know, if you look at 2014, we had about 500,000 people treated for ladder injuries. Not here, just here in Charlottesville,
right.
nationwide. But you know, this time of year, people hauling out their ladders for the holiday decorations. Maybe they're cleaning out the gutters. They're thinking, you know, the leaves are falling down. But typically, we see people hanging up stuff. Oftentimes, for people who aren't on ladders regularly, right? So you're, you know, it's not your job to be on a ladder. You're hauling out the holiday decorations and trying to get them done. And it's after work, so it's maybe a little dark outside and maybe a little icy outside, but you got to get the holiday decorations up. I know my wife likes things up and in place, and so we see them come off ladders sometimes, and unfortunately, then we have to take care of them in the emergency room or in the hospital.
So it seems simple enough, you know, you throw up the ladder and you climb up and you do what you need to do, but I'm sure you have some advice for folks who are getting ready to do all of that.
Yeah, it's, you know, the biggest things, so a lot of people have step ladders, and so you think about a step ladder and it has kind of an A-frame like that, and then they climb up and then they can't quite reach what they want to reach, and so they get up to the very top of the ladder and then the ladder tips over. Or sometimes we'll see people, you know, you're putting something up and you're reaching to get that last thing and you're leaning over, and so we really emphasize, don't climb to the top of the ladder, stop at least one rung below, and be careful about leaning. So if you're starting to lean and reach for that thing, stop, get down, just takes an extra 5-10 seconds, move the ladder over, climb back up. And if you do that, it's much less likely to tip over. So we talk about this 3 points of contact, both feet and an arm, and then doing something, or being centered over the ladder and not leaning out. Those are probably the injuries that we see the most. And then slipping. So you want the ladder, if you've got a straight ladder, overhanging at least 3 feet over the top, and making sure that the bottom is really well grounded, because the ladders will sometimes slip out. So we see people slip out this way, we see them fall off this way, and then we see people climb too high and the ladder tips over.
And some people have those rickety ladders that they probably need to replace in the first place.
Exactly. A trip to Lowe's or Home Depot is maybe not a bad idea this time of year. Treat yourself to a new ladder.
Okay, and UVA, great place though for everybody to come by if they happen to have a mishap.
Yeah, unfortunately, I mean, we're a level 1 trauma center, so we see the worst injuries, but we also treat regular injuries too, and we have a full multidisciplinary team, so we have people who can treat all the different injuries that people will have, and unfortunately, we hope not to see people professionally, but we're there if you need us, and that's what we're there for.
Cheers to a slow holiday season, at least for you, right?
We prefer to have a slow, exactly. We want people to have a healthy and happy holiday season.
All right. Dr. Weiss, thank you so much for coming out today.
It's my pleasure.
Sure do
Thank you.
appreciate it.